When this mother, who we will call Julie, went to pick up her child from a Melbourne daycare centre yesterday, nothing could have prepared her for what she confronted.
When I arrived at the daycare, there was camera crews and media, and I went into the daycare then and, asked the staff what is going on.
Julie was told there had been multiple allegations of child sex abuse against a worker who had filled in at the centre. What was it like inside the centre when you went in yesterday, when this news had broken?
The police had just left the centre as I was arriving, and you could see that the staff were visibly really distressed.
What did they tell you?
They told me that there had been a person who had been charged with sexual abuse and things related to children, and that person had worked in the centre. I think I was just shocked, and it took me a while to sort of process really what's going on. Like, has my child been involved in this?
Yesterday, senior members of Victoria Police, flanked by the Victorian Premier, Chief Health Officer, Minister for Police and Minister for Children, broke the news to the public. In May, the Sexual Crime Squad commenced an investigation after the discovery of child abuse material. Police searched the home of a 26-year-old from Point Cook named Joshua Dale Brown, a man not known to police prior to this investigation.
As a result, Brown was charged with over 70 offences which relate to alleged sexual assaults committed against 8 identified child victims.
Victoria Police took the unusual step of applying to have a suppression order lifted and identified Joshua Dale Brown by name.
This is unique. It's very important to ensure that every parent out there that has a child in childcare knows who he is and where he worked.
Brown had a valid working with children check. He worked at 20 childcare centres across Melbourne between January 2017 and May 2025. At some places, he worked for a few days, at other times for months. Victoria Police say they don't believe he worked interstate.
Last week, we had to inform the families of those 8 victims what had occurred to their child while in childcare. It was very challenging and, of course, very distressing for the families.
Today, Victoria Police confirmed it had laid charges against a second man, Michael Simon Wilson, as part of the same investigation. The allegations against Wilson are not related to childcare facilities. Julie says she never encountered Joshua Dale Brown, but he did work at the centre where she sends her child.
He was not in my child's room, although he did look after my child in lunch breaks, to what I know. But therefore, I haven't seen him, but my husband has seen him and said that he seemed quite friendly. He seemed to be, really caring towards the children.
The Chief Health Officer of Victoria announced that 1,200 children needed health testing and a text message to affected families was sent out. Julie called the Victorian Government hotline and spent 3 hours on hold.
So when I get through to the nurse, she tells me that my child has been affected and that I need to go and get STI testing done. And yeah, I just felt like I was a bit frustrated, and I said, I've been on the phone for quite a while and now I get through, I really feel I should have been contacted earlier, particularly before, the media release. I shouldn't really be finding out off the TV. And she just said that they have a high volume of calls.
What's it like to have to take your very young child to get tested for a sexually transmitted infection?
It's just really, really scary, to be honest, and you feel quite violating of your child because you have to go through both urine and blood tests. It's quite, horrific to even go through those tests.
2 of Australia's largest childcare companies employed Joshua Dale Brown. Affinity Education Group operates 250 early education centres, and G8 Education runs more than 400 centres. They issued statements yesterday. Affinity Education Group said it was deeply distressed by the nature of the charges laid. G8 Education said the safety and well-being of every child in our care is our highest priority.
Look, it's outrageous. Every time one of these companies gets in the media, they put out a statement saying children's safety is our highest priority. Well, obviously it's not. Otherwise, your company wouldn't continually be in the media.
Lisa Bryant is an early education and care consultant. She says urgent action is needed to improve the safety of children inside some childcare centres.
I think 7:30 has already exposed exactly what it's like in those centres over the last few weeks. What more do we have to do before someone's going to act? Isn't it enough that 1,200 children, are now having to be tested for STDs?
When we see too much attention given to profit or simply getting numbers on the floor, that's where we see holes come up in the systems.
Meena Singh is Victoria's Acting Principal Commissioner for Children and Young People.
Oversight starts with the childcare centre in and of itself. Have they got the appropriate people with the appropriate levels of responsibility, of qualifications, of experience to oversee what's being done by other staff in the organisation?
I think as a community, it's a big wake-up call.
Like hundreds of other Melbourne parents, Julie is waiting anxiously for her child's test results to see if they've been infected.
I feel sick and I feel very guilty that, I've exposed my child to this situation. I've lost a lot of trust in others and in childcare providers right now.